Hello, everybody. Welcome. And I have the graveyard shift after lunch where you will all nod off happily, having had wonderful food. Thank you very much for organising. And all the late people, yeah, just come in, take your own time. It's all right. Did you get your pudding? Yeah, good lad. Right. So it's sort of, in some ways, a little bit of a funny one, this, because we talking about the impacts of scars and reconstruction. So the impact is felt by all of you guys, and I'm the one who creates the destruction, but it's you are the guys that know more about the impact. So it's sort of a bit weird me trying to tell you about the impact when actually all of you guys can tell me more about it. But that's the way I try and approach things when I speak to patients in clinic and what we see, and then we try and adjust technique to try and make things as least impactful as possible, if that sort of makes sense. So literally, we'll talk a little bit about these sort of things. So very loosely speaking, skin structure, a bit about wound healing, abnormal wound healing, and if you've had any scars, and then how we can treat them and how make them a bit better for you. I said questions there, but I now know that comes at the end of the proceedings. I'm not going to really make this too sciencey. There's a few little pictures, but it's more to give you an overview of sort of the thinking and what we do, and how I try and think at every stage of what the impact may or may not cause. So, look, that's just a little slide. So we talk about skin structure. So obviously the clever oncologists, they do all the stuff that's going around systemically. And there is that phrase, we use that phrase cure, and some people say you can only cure and heal with cold, hard steel. And so what I do is I can affect where my knife touches, but as we all know, in different stages, the medicines, they do other things as well. And when we're looking at the skin, you've got things here, the outside of the skin, hairy bit on the top, or if you're like me, you've got a stupid hairy bit behind, as you try and grow a really crap mullet and think you're a teenage rugby player still. But then we go through the bits here. You've got a bit of dermis here. That's the strength in the skin. You have some fat, and that's where melanocytes sit. You've got fat and blood vessels. And whenever we create a wound, what we try and do is you try and restore the function, you try and restore the bits back to where they need to be. And that includes, there's muscle underneath there and all those sort of things. So when you create a wound, or you have a wound that happens, then these processes happen. So there's inflammation, your body doesn't like it. I've created a wound, so it gets really, really angry. But a little bit angry is good. Too angry is bad. Lots of cells go in there. They're there to mop away debris, and they're there to bring blood flow to the area to help the scar to heal. So a little bit of that happening is good. Too much of that is bad. And then it slowly remodels over time to form a well-healed scar. So when we're looking at things, we try and balance everything. And we are learning more, even stuff like the gut microbiome. It's all about balance. If everything is working in its sort of symbiosis, then everything is pretty much cool. It's like the last thing of, what was the film? Just Venom, isn't it? Oh, I love Venom. So he's living in a symbiosis with his environment, and we're just trying to have a good Venom, and then occasionally have the one that eats the naughty people that goes around. So anyway, let's move on to impacts, which is really what we're here about. So those are the things that I think are important. I'm going to pop to the bottom one there, put scores and grades, etc. So you'll probably see lots of score charts and things out there. This is a grade blah scar, or this is this scar, and this is that scar. I personally really hate score and grading systems. It doesn't really matter. So a grade 4 or whatever to me might not mean anything and cause no issues, but a grade 1 to someone else could be hugely life-changing for them. So this is why we look at, and it's got to be a case-by-case basis. So, I can look at a scar and go, there's nothing wrong with that. There's genuinely anything wrong with it, but it could still be a problem for the person in front of me. And that's the way I like to try and look at things and sort of move things moving forward. So the major impacts are, you got cosmesis. That's an obvious sort of thing. So there's, when we talk about higher value areas, evidently anything where the skin on show will be a more cosmetically sensitive area. So you've got the face. When we use words like, it's like a relatively cheap area. So you've got big areas on your back. It's got a bit more skin to move around. It's less, most people don't have their tops off all the time going around. So actually, you can hide scars a bit better, which means that when you're in public, you can hide scars a little bit better. Symptoms of scars, and so we'll talk about abnormal scarring a bit later on, but scars can be itchy, they can be painful, they can be red, and they're just a pain in the arse, really, and they cause you a problem. So it's how can we deal with those things? Function, and this probably comes more when people have had dissections and other things there. So in your arm, I don't want to raise my arms, I'm not sure I've got pit sweat from that, sorry. But if you raise your arm, I'll hide it from that. If you raise your arm, you might not be able to raise it as high as you want to do. So because of the scarring that's there, it's got really, really tight and you're unable to move your shoulder effectively. Groin, pelvis, head and neck. Can you not turn your head effectively to look over your shoulder when you're driving your car? So it's all that's when we talk about function, how we can lessen those sort of things. And when I mentioned about remodeling before, we've got to be patient with scars. They actually take 1 to 2 years to fully get better, to see where it's going to end up. And of course, at any point we can intervene if needs be. And then there's the big one. Probably the biggest one is psychological. So and there's no right or wrong answer for this, and this isn't to denigrate anybody, but some people will be a big reminder of what's going on, and that's not right for them. And of course, we can try and lessen it as much as we can, but that can be difficult. Some people, I don't know how to use the right phrase, it's not like a trophy or a scar, but it's though, okay, yeah, this is something I've gone through, and I've gone through it, and I don't mind it being there, and it's a positive. So you've got these positive and negative reminders, and it will affect different people differently. And that's what we try and sort of sort out and get it as best as possible. So here we go. Normal scar, all right? There's not much really to say about this. We've had a nice little scar. So they've a nice little scar into there. Something's been removed. It's healed quite well, and you get a nice straight line. So that is a normal scar. That could still be problematic for somebody. Yes, okay, it's in a relatively easy area to hide, but look, it's still a scar. So that could impact somebody. But that's what we'd want. That's what we all sort of want our scars to do. Now you've got something with a guy like this, he's got a skin cancer on it, so you see on his head a big lumpy thing, so that's going to need a bigger type of scar. And then to achieve that, we've had to take a bit of skin from somewhere else. So he's got a scar where the skin's come from, and where we choose that comes from might have an impact on what goes on. And then he's got that little patch there on his little head that's around there. And luckily, it's not done too badly. So when you have something, you're taking a skin graft, if you remember back to that picture, when we meant the skin structure, when you're taking out a melanoma or something like that, you take not just the skin, but you're looking to take a good margin all the way around. So your wide excision goes wide and it goes deep. In an area like that on your head, actually you can have things like a contour defect. So he didn't do too badly. Sometimes it can fill out, but sometimes it can look like Tiger Woods has taken a sandwich out and you've got a big lump in there. And then, so that's, some people just don't like that, and rightly so. Then you have other scars. This is on the face where you have a lesion that's taken off. So if she had a big scar on her temple, I've had to move bits around, and I thought I'll be nice and clever. But the bigger the surgery, the bigger the potential loss and post-op complications. So there's a sort of or a yellowy tint around there because I had to use iodine dressings. If you look right in the little sort of corner, I don't know, the point is coming, right in here, the wound's starting to come apart a tiny little bit. I've maybe pushed it towards the limit. I think this scene, you can just see where the red bit is there. And so she's just teetering on the brink, and that's got an impact on her. So it's coming for regular dress. This is a time impact then. Had the surgery, regular dressings, more than you need to come. What's going on? Do I need antibiotics? Do I not need antibiotics? You know, me personally, still, I mean, I love the gut microbiome, going back to it. And I think this is something you should take away as well. I try and use as little antibiotics as possible for your treatment. And I think sometimes people go in too quickly. There is it's a bit of a side job on this. There's a difference for me between colonization. A wound can be a bit red and a bit naughty. And it's just got bacteria, as we know, living on us, that you don't need to jump in with antibiotics. Washing, silver-based, iodine-based dressings can just get you through that thing without giving you antibiotics, wiping out your gut flora, and then that, I'm not allowed to swear, am I? That fucks you up. If you wipe out your gut flora, and we don't want that, especially because of the brilliant researchers out there say that the less antibiotics you have, the better the systemic therapy works for you. So this is a thing where, I managed it successfully without jumping in with antibiotics. And then she had an all right scar, which you can barely see. This is like, she's like Harry Potter. It's like Harry Potter's mum. But here we go. Every now and again, it goes a bit wrong, even for me. And so this thing, stitch marks. Okay, you can argue it's actually the straight line scar is not too bad, but then you do get a little bit of stitch marks that are either side. Now, again, dependent on site, depending on where it is it a problem? Is it not a problem? I see that as a normal sequelae, but again, someone else, it might be an impact for them. That is pretty much created by, when you put your stitches over and over, there's nothing wrong with doing that, you're creating little epithelial tunnels. And it's just as the skin is healing, it just forms those kind of things. And you have to leave your top stitches in long enough that the wound knits together, but you want to take them out before it can potentially form that. Sometimes you've got no choice but to leave it that long, and that's something you accept. There's there. Bit of a stretch scar. I've got another one saying a stretch scar there. That one's a bit paler, but that's when essentially, I'm going to put this in here. Hang on. So when I'm still on. Am I still on? Yeah. Excellent. So when you put the skin together, essentially you're making everything stitched together. So as they come, your fibers are interlocking, and the stretch scar is just. Everything is just stretching. It's staying together, but everything's just stretching out a little bit, normally in areas of movement. So, it could be on the back, chest, all those sort of things. And that's what happens. That's a normal sequelae of what's going on with the scar. Again, it can have implications. Hopefully, it can lessen the impact, but it's one of the things you can do. Hypertrophic scar, that's got a bit big, it's a bit angry. And again, this sort of thing happens really in white people, mainly behind the ears and the chest. And, in black people, when you look at keloid scars, we'll come on to the next one, that can be sort of anywhere on the body. And some people just form them more than others. So especially if you're having multiple surgeries, you can think, okay, what am I going to do? What can I expect? How can we lessen these sort of things and lessen the impacts of what's going on? And this is a keloid scar. Look, it is one of my patients. It's on an area of the shoulder. It's stretched out, it's got angry, and that's because, if we go back to what we were talking about before, the inflammation, the cell proliferation, everything's just got out of order, and it's trying to overheal itself. It really, really is, but it just can't do it. So when we get problems like this, what we can do is to try and do other things to try and get to the bottom of it. There's massaging the scar, the silicone gels, the bio oil, and all those sort of things. Now, there's nothing wrong with those ones. I think a big part of the scars being broken down is the massage, and you can use normal moisturizer on those, and that's your slip medium. So with that big clump of scar tissue, you've all had it, and it just feels hard and lumpy. And massaging it just breaks those down, and you're looking to slowly break it down, but that's that year or 2 years worth of remodeling, and you're hydrating the skin. It's lost its ability to do that effectively. For things like keloid, because the inflammation's it's going berserk. It's like if you go to a kid's party and give them a ton of E numbers, they just run around like absolute idiots. Then the steroid injection is there. That's okay. Story time now. The clown's gone away. Just sit down. We'll just give them that. Give you another sugar load and wait for the drop, and then you drop them off at the parents until they then rebound and then they have the problem. Laser's really good for. If you've got a wide scar, you can have little nice cuts, and you can make the scar, it forms little cutting cones, you can make the scar smaller. You can also do stuff with the colour of it, and there's things like pressure garments, and you can resurgerize. So if a scar's really tight, you can make it longer by doing like that little patterny type thing. There's other kind of ways you can do this. But I'll give you an example of how laser works. We had a bit of an angry scar on the chest. That was then I cut it out, and then that's a reaction to dressings. I didn't get that very right, did I? And the scar's looking nice at that point. And then if you go to the main one, then actually it starts spreading out, starts there, goes there, and it's almost going back to where it is. It's an area of stretching. So, of course, the laser treatments, and you can just get it to sort of fade a little bit. You never quite get rid of the stretch, but you can get a little bit of fade, which is quite cool. We'll move on to some bigger stuff. Well, how much longer have I got? About another 5, is it? Yeah, I'm on time still. Thank you very much. So a bit of sort of reconstruction. Now, I've got to put this one in because it's my favourite, and I'm going to do that thing. I still hold the record in the lab for the largest tumour that a lymph node tumour that they've had. But this lady is one of my favourite patients. They're all my favourite patients. Is that right, Mrs. Roper? Yeah. And you, Liesl. Don't worry. So this lady, she had a really big tumour. So we're talking about impact here. This is a really... So she was PTX. And this just grew. Never found a melanoma on her. One big lymph node tumour. And I was like, what on earth's going on here? And this is, we're talking about impact. So we go back to the impact. So this is a massive impact for her. And I was really lucky that we got each other, and I had the initial consultation. In fact, I might tell you this. So she said she thought she was all right when she met me, partly because I think I saw her and said, yes, okay, we'll sort it out. And then I just started talking to her husband because we liked the same American football team. We liked cookery and all this. And I was wearing cowboy boots at that time, and he's from the States. So we just started yabbering on about stuff. And she told me this a few years later that she said, I realized I was going to be okay because you didn't seem that concerned because you were just chatting to my husband. What she noticed, I was absolutely shitting myself because this thing's massive. And I'm thinking, there's a small chance she might lose a leg. It's quite close to the vessels, and this is going to take me a while. And I was bluffing, but fortunately, there was hustle behind the muscle. Don't worry, but fortunately, with her, we managed to take the whole thing out. I got most of it closed on the bottom, but as you can see, there's an area where I had to do a skin graft. There's just a huge area of skin attached to tumour I had to take. Now that, functionally for her, has no impact. It's in a hidden area, so potentially, actually, psychologically, it's not too bad. But that for her, it's been no problem. But you can see for somebody else, it could be a huge problem. Do you know what I mean? But I think it's not too bad. I think it's not too bad. I think we've done okay. And that's just where we took the donor site from that's there. But that's just an example of how the impact of the scar, and, I actually shouldn't really be still following her up. She's past follow-up, but she cooks for me. She's brilliant. She cooks for... She brings me in blueberry muffins, and she brings food for the family. So I say to her, you said you're not supposed to be back. She said, I don't mind. So I see her a couple of times a year. And my kids go ballistic when they say, finally, we've got some decent food because your food sucks, Dad. And she brings it through. And they send a little video messages saying thank you every time. So it's cool. It's not, oh no. The kids aren't normally that sweet. They're teenage daughters, and they're all horrendous. But we have here, there's a wound that's on the leg. So sorry for the graphic images. 5 minutes, and now 5 minutes. Sorry for the graphic images. But look, big wound in the leg. So here we go. I've got to think about what can the impact be for this person. So there's a cosmesis element to it. Again, this is the whole big divot's been taken out, like your sort of Tiger Woods kind of thing. If I just do a skin graft on that, is there anything we can do better? And not just that, it's about the lymphatic drainage of how it goes through. So there's always a risk of lymphedema and all those sort of things. Even without a dissection, you alter how the lymphatic drainage happens on the limbs just by the surgery we do. So this one, I moved a little bit of tissue locally just to cover the area. And despite having bigger scarring, actually it's maintained the form a little bit better. You can have that thing. And actually it keeps the lymphatics going through. You just sort of shifted them across. And everything is doing all right. What I will go on to now, so there's a little video that's going to run with this guy. And I'll sort of try and narrate... I'll try and narrate. I'm sorry. So the next video that I'll go through will be someone who's had a nasal reconstruction. So it's not a melanoma, but you're going to get the picture. She's allowed to talk. It's all right. She's doing it quietly, unlike you, Imogen. So she... It's all right, hi. So this one, they've had, unfortunately, a skin cancer, basal cell carcinoma, which required taking off some of the nostril, but I'm going to show you the reconstruction that we had to do in stages on this guy. So come on. And then I say, run VT. So if it's going, that was the initial basal cell carcinoma. Dermatology surgeons created a hole that big, and then they did a bit of a flap and a graft, and we thought we had it clear. But no, it came back on the inside of his nose, it's under there, as you can see there. So what that required is, Oh, that's me telling him the bit of cartilage I removed on his ear, but telling to replace it. He's got a big hole. That's me learning to use the live function of the phone not very well. So he's got a big hole in his nose, as you can see there.
Like that?
So what should I pause it? Does it pause? Yeah. So what we've had to do, he's basically lost pretty much all of his nose. So that picture that I caused in there was you took the lining, so impact. You can lose a bit of your ear and you're all right. I mean, if you're Prince Charles, you can lose a whole lot and then you're okay. And that can form the inside of the... Don't get all royalist on me, you know what I mean. I know it's King Charles, that's all right. Anyway, that forms the inside of the lining, and we borrowed a bit of his head and we flop it down because you need to form the inside and the outside, and you need some cartilage support. So that's what I did with him. I'll run VT again, and that's it in its one stage. But you have to have it connected so while it picks up the blood supply. And then we get to a stage where we can disconnect it and put it through to there. And then eventually, and that's just me dressing it up, and then eventually you see that we can have there. Now, impact and a thing with him, and it's not too bad. And the worm's eye view that nobody looks at, but you put in there anyway because it makes you look really good, is the impact scar, and he's got a bit of a scar into there. However, I've taken that as a lesser impact compared to having a big hole in his nose, and being able to do the reconstruction and get that sort of thing for him. And he's doing all right. We've cleared it, and that's fine. But so those are just a whistle-stop view of how we look at a form of impact. But I think the important thing is it's the impact that you guys have on you and your scar and your surgery. And so never feel bad speaking to a surgeon about how a scar affects you, no matter how bad or not it is, or what it's like compared to other people. This is all your journey. It's all very, very personal to you, and everybody's got their own things that they worry about and they need to try and sort out. And it's up to our job as a surgeon, you try and lessen that impact or make it as little as possible as you go along your journey, and hope you're on your way. And I believe I have some time left. Well done. Thank you.